Good afternoon, Dr. Frere. Would you like to get started?
Yes, I think, well, is it 2 o'clock?
It's just now 2 o'clock, and
Okay,
Dr. Singhal is already on.
Wonderful.
Okay, excellent. Good afternoon, everyone. Thank you for joining the Los Angeles County Department of Public Health today, September 1st, for a media briefing. We have Dr. Barbara Freer, Director of Los Angeles County Department of Public Health, and Dr. Rita Singhal, Chief Medical Officer and Director of our Disease Control Bureau, presenting. Once they've given their presentations, they will take your questions. As a reminder, if you have a question, you can raise your hand using the hand icon, or you may chat me, the host. Dr. Freer, when you're ready.
Yeah, thank you so much, and good afternoon, everyone. Thanks for joining today's briefing. As Kim noted, I'll give a COVID-19 status update for LA County. That will be followed by an update on monkeypox by Dr. Singhal. In today's COVID presentation, I'll share our current metrics, including our CDC COVID-19 community level designation. We'll look quickly at the LA County early alerts. I'll provide initial data on school clusters and outbreaks for August. We'll also, we have some additional data that we've looked at around deaths from COVID, and close with a couple of messages, one about the Omicron bivalent booster vaccine, which just received emergency use authorization from the FDA, and also some sensible measures for having fun, staying safe over the Labor Day weekend. I'll take the first slide. This past week, we've had significant further declines in cases. Today, we're reporting 2,566 new cases, with an average of under 2,600 cases per day reported for the past week. This represents a 16% decrease from the 7-day average of 3,100 cases per day that I reported last Thursday. Due to a recent change in the survey that's used by hospitals to submit data to the California Department of Public Health, there have been some past irregularities in the hospitalization data for some of the recent days. We are working closely with CDPH to resolve this issue, and we've been updating the hospital data to reflect corrected information as soon as it becomes available. The data on this slide here is the most updated and corrected information we have as of this morning. And although it's still subject to change, the preliminary data shows an 11% decline in the average COVID positive hospitalizations across LA County over the last week. The 7-day average test positivity rate also decreased this week. It's currently around 8%. It was just over 9% last week. We've reported an average of 14 deaths per day over the past week. This is just a tiny increase from last week, where we reported about 13 deaths per day. These ongoing slight fluctuations in our death numbers may indicate that deaths are plateauing. And I'm going to talk a little bit more about COVID deaths in our later slides. Older adults, as we all know, in LA County continue to experience deaths from COVID at a much higher rate than young adults. As always, our hearts go out to the many people who have lost a loved one to COVID in recent weeks. We do wish you peace and healing. Next slide. On this slide, we're tracking the trajectory of the pandemic since March of this year. The green trend line is the 7-day average of the number of cases reported daily. And as you can see, it continues to demonstrate the significant ongoing decline in reported cases that started in about mid-July. The 7-day average daily hospital admissions, that's the orange line. However, as I just noted, this data has some concerns attached to some errors in the reporting. As we get updated information from CDPH, we'll continue to make adjustments. You can see that admissions are starting to decline again, and we think the issues that are related to that small increase may have contributed to, may be associated with some misreporting in the admissions data. As a reminder, the trend line for cases are measured on the vertical axis on the left side of the graph, while the hospitalization and death trend lines are using the vertical axis on the right side of the graph. I'm pointing this out because it could look like the hospitalizations are now above the cases. But in fact, daily hospital admissions are at about 130 and daily reported cases are at about 2,600. As noted earlier and shown by the blue line at the bottom of this slide, the 7-day average number of deaths reported daily remains relatively unchanged. Go to the next slide. We continue to use the CDC's COVID-19 community levels framework to monitor the strain on our healthcare system caused by COVID. As you know, the CDC's framework utilizes 1 case rate metric and 2 hospital-related metrics. The first metric used to calculate LA County's COVID community level is the 7-day case rate, which CDC reported at 193 weekly cases per 100,000 people. This is a decrease from about 229 just last week. The first of the 2 hospital metrics is the 7-day total of new admissions per 100,000 people. Today, the CDC reported LA County's rate is 9 weekly hospital admissions per 100,000 people. This is a slight decline from the 9.6 they reported last week for LA County. The second hospital metric is the 7-day average for the proportion of staffed inpatient beds that are occupied by COVID-19 patients. Today, CDC reported this metric for LA County at about 4.9%. This is a decline from the 5.3% that was noted last week. Now that our weekly case rate has dropped below 200 per week per 100,000 people, we do reference the upper part of the chart to determine our community level. With both our hospital metrics remaining below 10, CDC will designate LA County now at the low community level. Moving into the low community level reflects minimal stress on the hospital care system in LA County associated with COVID-19. However, viral transmission with a case rate of just below 200 is still high, as it represents about 2,600 new cases a day. Our hope is that we can continue to slow transmission so that we reach a weekly case rate of less than 100, which would drop that daily number of new cases to 1,400. Next slide. I do want to provide a quick update on the COVID-19 early alert signals for LA County. And as you know, we're reporting with improved metrics, especially with less transmission. Our early alert signals also show major improvements. Since last week, there have been decreases in 4 early alert signals. The percent of emergency department visits that are COVID related decreased slightly from 6.6% to 6.4%. The case rate in the lowest income areas decreased from 177 to 167 weekly cases per 100,000 people. The number of new outbreaks reported per week in settings for people experiencing homelessness decreased significantly from 13 to 4, and the number of new worksite clusters reported per week also declined from 144 to 123. Starting this week, we'll be tracking BA.4.6 on the variant early alert metric. Given that this metric is intended to track newly emerging variants, it no longer makes sense to track BA.4 and BA.5 here, since they've been circulating in LA County for nearly 4 months. As of the week ending August 13th, BA.4.6 accounted for 1% of sequenced specimens, indicating low concern. There was no change in the number of wastewater systems with a recent 2-fold increase in viral concentration. This remains at 0, and we continue to see declines in those concentrations. There were 2 early alert signals, both related to outbreaks or clusters that experienced small increases. The first is the number of new outbreaks in skilled nursing facilities in the past 7 days increased slightly from 16 to 21. The second is the number of new outbreaks in TK through grade 12 school classrooms increased from 13 to 19. This likely reflects the increase in the number of schools that have reopened. Sector-specific plans are in place that continue to promote safety at schools and nursing homes, and public health staff are assigned to support outbreak mitigation at all of these sites. I'll review a few early alert signals in more detail in the next couple of slides. We can go to the next slide. The Omicron variant, as you can see here, continues to account for 100% of sequenced specimens. The BA.5 subvariant of Omicron, shown by that larger bright red section at the top of each bar, remains the predominant subvariant by far. For the week that ended August 13th, 92% of all sequenced specimens were BA.5. This is a slight increase over the 90% from last week. The CDC estimates that across the country, as of the week that ended August 27th, BA.5 subvariant accounted for 89% of specimens. The relative proportions of other key sublineages we're tracking have changed only slightly, including BA.2.12.1, that's those small orange bars almost at the bottom. That's declined to about 1.2%. BA.4.6, you could see with the yellow bars, increased a tiny bit from last week to 1.3%. But there are reports of BA.4.6 gaining ground elsewhere in the country, particularly in the Midwest. And CDC estimates that nationwide BA.4.6 accounts for about 7.5% of specimens. However, our latest local data, which again has a 2-week lag, shows BA.4.6 remaining very low here, with no significant week-to-week increases. To date, only 4 specimens of BA.2.75 have been detected. This is the same as last week, indicating again no significant increased circulation of this sublineage in LA County. Given the decline in our case rate, our low community level, and the absence of increases in the circulation of new subvariants, we are encouraged that risk is declining for many people in the county. However, since mortality from COVID remains high for some residents, and virtually all circulating subvariants have shown some ability to cause repeat infections for those who already had COVID earlier in the pandemic, it does remain prudent to use common sense measures to avoid repeated exposure to yourself and to avoid transmitting the virus to others. Next slide. In the past few weeks, as more schools opened across the county, we began to see increases in clusters of cases and outbreaks. This is at schools. This is not unexpected as classes are convening together for the first time since the summer. This year, schools are no longer required to report every single case of COVID to public health. However, they are required to report clusters of 3 or more cases in a classroom, office, or an identifiable group, such as teammates, club members, or other cohorts who were on campus or participated in school-sanctioned activities within the 14 days before getting sick. The table in this slide shows the number of clusters reported in the past 3 weeks and the number of student and staff cases associated with the clusters. There have been a total of 624 clusters reported at schools since August 7th that involved over 3,500 individuals, of which 3,355, the vast majority, were students. You can see that the number of reported clusters more than tripled each week throughout August, likely correlating with the increases in the number of schools that are open. Next slide. We also track outbreaks at schools and at school-associated youth programs, as these are known instances where there's documented transmission in a particular setting. This slide captures outbreaks in the TK through 12 school settings and youth programs during the summer and into the beginning of this school year. During June and July, many of the tracked outbreaks occurred in day camps and youth programs, and you can see that those are the shaded areas with light green color. Since school districts began opening in early August, 27 outbreaks have been documented in elementary schools. That's the light purple area. 8 outbreaks are associated with youth sports programs. That's the orange shaded area. And 5 outbreaks have been documented in middle schools. In August, there's been only 1 outbreak associated with the high school. Because Omicron remains extraordinarily transmissible, many of these outbreaks involve a significant number of students. Of the most recently opened outbreaks, most involved more than 5 students, and a couple involved more than 20 students. While it's important to track information on school outbreaks, the vast majority of schools in LA County have not experienced any outbreaks. And this is because school communities are doing a great deal of work to keep students and staff safe. All schools are still required to have a COVID-19 containment, response, and control plan, and to have in place a COVID-19 compliance team. And while schools don't report every case to the Department of Public Health, they do act anytime there's a single COVID case at the school. Any student or staff member with a positive test is sent home to isolate for at least 5 days after their symptoms start. If they test negative on or after day 5, their symptoms are improving and they're fever-free, they can return to school after day 5, starting on day 6, as long as they wear a mask indoors through day 10. Schools also do their very best to determine those who are close contacts with any positive case that attended school during their infectious period. The school notifies close contacts who can all remain at school during the 10-day virus incubation period, provided they're asymptomatic, wear a well-fitting mask indoors around others for 10 days following their last exposure, and get tested once 3 to 5 days have passed after their exposure. Next slide. Yesterday, CDC reported on the decline in U.S. life expectancy for a second year in a row. Life expectancy dropped in 2021 to just over 76 years, after dropping from 79 years before the pandemic in 2019 to 77 years in 2020. This is the first time U.S. life expectancy declined for 2 years in a row over the past 100 years. Life expectancy declined more for men than for women, and more for American Indian and Alaska Native people than for other racial and ethnic groups. COVID-19 was the leading driver of the decline. As we've discussed in these media briefings, COVID-19 has been a leading cause of death here in LA County as well, tragically shortening the lives of too many. And while we've seen significant decline since the beginning of the pandemic in the mortality rate associated with COVID, thanks to high vaccination rates and effective therapeutics, COVID, as you can see on this slide, remains a dangerous virus. This slide compares the county COVID mortality rate from May through July of this year versus May through July of last year, noting the overall death rate for the county, as well as the death rates by age groups for adults 30 and older. The number of deaths in younger age groups for this short time period were too small for us to be able to calculate stable mortality rates. Countywide, there were more deaths and a higher death rate this summer than last summer, driven primarily by the higher mortality rates among those 65 and older, who have always been at highest risk. Sadly, the mortality rate for residents 80 and older increased threefold this summer compared to last summer, and the mortality rate for residents 65 to 79 increased as well. While it's important to note that the mortality rates for those in younger age groups slightly declined over comparing these same time periods, Omicron does remain a variant that's capable of causing significant harm to many members in our community. Next slide. While the last slide demonstrated the disproportionate impact of COVID-associated deaths on older residents, this slide allows us to look at the impact of COVID on premature deaths. Premature death is defined as a death before 75 years of age, and the leading causes of premature death are determined by calculating the years of potential life lost before the age of 75. With 25% of deaths to date this year occurring to residents under the age of 65, paying attention to the impact of COVID on premature deaths is relevant. In 2020, which is the last year for which we have complete data to do this analysis, COVID-19 was the leading cause of premature death in LA County, accounting for almost 79,000 years of potential life lost. This was more than the number of years of potential life lost from diabetes, suicide, stroke, and lung cancer combined. Drug overdose, as you can see, was the second leading cause of premature death in 2020, with a 65% increase since 2019. And coronary heart disease was the third leading cause of premature death. It's important to note that for all causes of death on this slide, except suicide, the years of potential life lost increased from 2019 to 2020, pointing to the broader impact of the COVID pandemic beyond the morbidity and mortality that's associated with the virus itself. In part, this is because a highly infectious virus translates to many individuals experiencing disruptions at work, at school, obtaining health care, and in their social lives. These disruptions very likely have an impact on our overall well-being. I share this information not to create alarm, but rather to explain why taking sensible precautions still makes sense. Getting vaccinated and boosted and accessing therapeutics reduces the chance of experiencing severe illness for those who end up infected. And wearing masks, testing as appropriate, and staying away from others when sick reduces transmission. These actions make it much easier to not experience the disruptions that we have in the past while we continue doing daily activities that give our lives purpose, like going to school or going to work, visiting family members, and gathering with our friends. Next slide. Because vaccinations remain our best defense against severe illness, we're pleased to report that the updated bivalent vaccine boosters received authorization by the FDA earlier this week on Tuesday. And we expect that once CDC completes their review, these new boosters will be available in LA County next week. The FDA amended the emergency use authorizations for the Pfizer and Moderna vaccines to now include their bivalent boosters. The new booster vaccines, which are also referred to as an updated booster or bivalent boosters, contain 2 messenger RNA components of the SARS-CoV-2 virus. This is not a live virus. This is part of the RNA. One is of the original strains of the SARS-CoV-2, and the other one is of the BA.4 and BA.5 lineages of the Omicron variant of SARS-CoV-2. The process for producing these boosters is the same process for producing the boosters we've used in the past and for the vaccine. The Moderna updated booster is authorized for use in individuals 18 years of age and older, and the Pfizer updated booster is authorized for use in individuals 12 years of age and older. Both received authorization for use as a single booster dose, given at least 2 months following a primary or booster vaccination. Note that with this new authorization, FDA deauthorized Pfizer and Moderna's original monovalent mRNA vaccines for use as boosters in those aged 12 and older. Although Pfizer's vaccine formulation for children is still authorized as a booster for children ages 5 to 11. This means that at vaccination sites all across the county, they will not be able to administer boosters for residents 12 and older until we receive the new bivalent single-dose boosters next week. The CDC Committee on Vaccine Use is meeting today to discuss the bivalent boosters, and they're expected to share guidance regarding their use very soon. Next slide. In LA County, we'll be ready to start administering doses next week, these booster doses next week by Wednesday, September 7th. We've already pre-ordered about 170,000 doses, and we expect to receive these doses between the 6th and the 9th of September. More than 300 different healthcare providers across LA County are preparing to administer the bivalent booster starting in mid-September, and many providers are expected to offer the boosters at multiple locations. This map shows all the sites that will be providing the bivalent booster vaccine next week. It includes 12 public health sites, 701 mobile vaccine clinics, and 245 community pharmacy or clinic sites, for a total of 958 sites across LA County. The priority, as always, is to ensure easy access to the bivalent booster for everyone who's eligible. And as we roll out the bivalent booster vaccine, we remain focused on ensuring that there's good access to the new boosters in the hardest hit communities, which are shown on this map in the light green shaded areas. As always, residents and workers can search for places offering the new boosters on our website, vaccinatelacounty.com, and click on Find a Location and then search by vaccine type. Next slide. I want to close by noting, as we look forward to celebrating Labor Day and expressing our deep appreciation to the many hardworking people throughout our county, we face the twin challenges this holiday weekend of ongoing circulation of COVID plus very high heat across most regions in LA County. As we have fun connecting with family and friends, there are some practical steps to take that can make our celebration safer and more comfortable. As always, we ask that those who are sick or test positive for COVID stay home and away from others. If you're infected, you may benefit from starting medication early to prevent severe disease. So please consult with your healthcare provider right away, or call our public health information line about accessing free COVID therapeutics to avoid serious illness. The information line 833-540-0473, open every day of the week between 8 in the morning and 8:30 at night. You can also always visit ph.lacounty.gov/COVID care for additional guidance on what to do if you're sick and how to access COVID-19 medical treatment. We ask that you get tested if you're experiencing symptoms of COVID or you've had an exposure to someone with COVID. Testing before and after travel is still recommended as a protection that can help reduce spread, as is the recommendation to please test before gathering with others indoors, particularly if older adults or people with underlying health conditions might be present. While gathering outdoors reduces the risk of transmitting COVID dramatically, given the excessive heat, please take extra precautions this weekend to avoid sun exposure and heat stress. If you are outdoors, gather in the shade, such as under trees, umbrellas, and patio covers. Have plenty of ice and water for everyone, and use fans for cooling. With the extreme heat, it will make sense for many to move gatherings indoors. When gathering indoors, you can maximize ventilation, opening windows and doors, using your air filters, setting your HVAC systems to maximize fresh air exchange. It's also advisable to wear a mask if gathering indoors with individuals whose COVID status is unknown or who are elderly or immunocompromised. Given the high heat we're experiencing, we do ask that everyone do their part to take care of those most vulnerable by checking on your friends, family, and neighbors. Older adults, babies, pregnant women, and those with underlying health conditions are especially vulnerable to heat stress. Please never leave children, pets, or elderly persons in parked cars, even for a few minutes. Be sure to drink a lot of water and seek medical care for yourself or anyone experiencing symptoms of heat-related illness. There will be cooling centers open throughout the county for the next week, and many are already open. Spending a few hours in a cool setting can be life-saving when temperatures are high. You can learn more about cooling centers and tips for staying cool at our website. It's abbreviated here, tinyurl.com/extremeheat2022. And now Dr. Singhal, the Chief Medical Director for the LA County Department of Public Health, will give an update on monkeypox. And after that, as always, we're happy to answer your questions.
Thank you, Dr. Ferrer. Good afternoon. I'm pleased to join you once again to provide an update on monkeypox. I will provide a situational update and share data regarding monkeypox in persons living with HIV and for persons who have received the monkeypox vaccine, review our vaccine eligibility and distribution, and review what resources are available for residents and partners. I'll take the first slide, please. So worldwide, we have surpassed 50,000 cases, with 51,257 cases of monkeypox reported across 99 countries. This includes nearly 19,000 confirmed cases in the United States. California is now the state reporting the largest number of cases in the United States, with 3,629 cases. As of today, there have been 1,518 cases of monkeypox identified in LA County, as well as 82 cases reported in Long Beach and 18 cases reported in Pasadena. The profile of cases in LA County continues to be consistent with what is being seen across both the country and the world. As reported on our public data dashboard on August 26th, the median age of monkeypox cases in LA County remains at 35 years. 98% of monkeypox cases report being male, and 96% of cases where sexual orientation is known report being LGBTQ+. New on our dashboard is data on monkeypox cases among persons experiencing homelessness, or PEH. There are 48 cases of monkeypox among PEH. 22 of these cases are among those in temporary housing situations, such as those that are staying at hotels or motels or couch surfing. 16 of the cases are unsheltered, living on the streets, encampments, or in parks, and 5 cases are in PEH congregate housing settings such as shelters. There's also 1 confirmed case in the jail system. In Los Angeles County, there have been 49 hospitalizations among persons with monkeypox. There have been no deaths due to monkeypox in LA County or California. Earlier this week, there was a report of a death of an immunocompromised person with monkeypox in Texas. Although not confirmed or reported by CDC, this would be one of only a handful of deaths among monkeypox cases seen around the world in countries where monkeypox is not endemic. Next slide, please. Here we have the epidemiological or Epicurve for monkeypox cases in LA County by episode date or when the case reports symptom onset. The columns show weekly case numbers beginning mid-May through last week. As you can see, after rising steadily through June and July, we have reached a peak of 233 new cases in the week ending August 6th. Since then, we have plateaued with a small drop in cases the week following, and then a small rise in cases the week ending August 20th. Due to a lag in data reporting, the data is incomplete for last week. In addition, I can report that although a month ago we were seeing a doubling of monkeypox cases in as few as 8 days, our doubling time has now increased to 22 days. The plateauing epicurve and the longer doubling time may be early indications that monkeypox virus transmission is beginning to slow in LA County. Similar trends are being noted in countries where the outbreak first began, as well as in other US jurisdictions. We will be watching this curve closely over the remainder of this week and next week to see if the leveling off of new cases is sustained. Next slide, please. Today, we are also reporting new data on HIV and monkeypox co-infection. These data, which are derived by matching monkeypox cases against HIV surveillance data, indicate that 42% of monkeypox cases in LA County have been among people living with HIV, which is consistent with countrywide estimates from the CDC. While the high rate of co-infection is concerning, the majority of monkeypox cases who are living with HIV are connected to care. In fact, 89% of HIV positive persons diagnosed with monkeypox in LA County were engaged in HIV care in the prior 12 months, and 77% were virally suppressed. To further understand the impact of monkeypox virus infection among this group, Public Health is collaborating with CDC on a national report that will describe the clinical manifestations of monkeypox among persons living with HIV using data from local health jurisdictions from 5 states around the country. These data highlight the need for our providers to ensure that HIV patients who are eligible for monkeypox vaccination are being vaccinated. We are working to onboard any remaining HIV providers who are not in our monkeypox vaccine provider network, and we are also meeting with our stakeholders and providers to discuss messaging and outreach to this population. Next slide, please. With vaccine supplies increasing, Public Health continues to rapidly distribute and administer monkeypox vaccine doses as they become available. Under phases 1 through the first tranche of phase 4 of federal allocations, we have received over 113,000 doses of the Jynneos vaccine. As of yesterday, 56,271, or 50% of these doses, had been administered. As a reminder, last week, the federal government announced phase 4 allocations. LA County has been allocated 24,767 vials, or about 120,000 doses. Distribution of phase 4 doses is occurring in 3 tranches, with each tranche comprised of 1/3 of the allocation. Late last week, LA County received the first tranche of this allocation, which is 8,260 vials, or about 41,300 doses, which is included in the total received dose number on the slide. The remaining doses, which LA County will have access to once we have administered 85% of current vaccine doses, total about 82,500 doses for tranches 2 and 3 of phase 4. Of note, these dose numbers are based on extracting and administering 5 doses per vial, so they are conservative estimates. Next slide. Today, we're also sharing key demographics for individuals who have been vaccinated against monkeypox in LA County. These are based on August 30th data for 47,404 first doses of vaccine administered. In addition to these first doses, about 6,716 second doses had been administered as of Tuesday. With the exception of our race ethnicity data, which I will discuss next, the demographics of those receiving a first dose are generally consistent with the demographics of our monkeypox cases. The median age was 37 years, 91% report being male, and 91% report sexual orientation as LGBTQ+. Data by region indicates that 42% resided in service planning area or SPA 4, and another 14% in SPA 2. These vaccine demographics are now available on our public dashboard, which is updated weekly on Fridays. Next slide, please. When looking at our race ethnicity data, there were some notable differences between our monkeypox cases and persons who had been vaccinated against monkeypox. Here in this figure, on the left, you see the race ethnicity breakdown of our monkeypox cases, and on the right is the race ethnicity of those who received a first dose of monkeypox vaccine. Whereas 40% and 11% of monkeypox cases are found in the Latinx and Black populations respectively, of those who received a first dose, only 32% were Latinx and 9% Black. To address these lower rates of vaccination among the Latinx and Black population, Public Health is working with community-based organizations that serve these populations on monkeypox control efforts, including but not limited to conducting outreach to ensure increased awareness and education, and identifying locations for vaccination events that improve access to the vaccine. Next slide, please. As I shared last week, following the announcement of LA County's Phase 4 vaccine allocations, Public Health expanded its vaccine eligibility criteria to include additional groups that are at higher risk for monkeypox infection. This week, we're reminding residents who meet our expanded eligibility criteria to get vaccinated as soon as possible to protect themselves and help us to continue to slow virus transmission in the county. Gay or bisexual men and transgender persons who had multiple or anonymous sex partners in the past 14 days, as well as those who had skin-to-skin or intimate contact, such as kissing or hugging, with persons at large events or venues in the past 14 days, are eligible for vaccination. Additionally, persons of any gender or sexual orientation who engaged in commercial or transactional sex in the past 14 days, meaning sex in exchange for money, shelter, food, and other goods or needs, are also eligible for the monkeypox vaccine. Residents who met prior eligibility criteria remain eligible for vaccination, and we continue to prioritize residents who are immunocompromised, including those with advanced or uncontrolled HIV, since they may be at high risk for severe disease. Residents who do not have access to the internet or need assistance accessing the vaccine can call the Public Health Call Center at 833-540-0473. Our staff are available to take calls 7 days a week from 8 a.m. to 8:30 p.m. in multiple languages. Next slide. Los Angeles County residents who are eligible for their first or second doses of monkeypox vaccine can take advantage of several options to get vaccinated. We now have 53 community providers actively vaccinating their patients for monkeypox. We encourage residents who are eligible for a first dose or due for their second dose to contact their regular healthcare provider and ask if they are offering monkeypox vaccine. Residents can also get vaccinated through public health pods and other community sites. The process has been streamlined and pre-registration is no longer required. For a number of sites, eligible residents can walk up directly, and for others, appointments are available. The list of vaccination sites open for walk-up can be found on the public health webpage at ph.lacounty/monkeypox. ph.lacounty.gov/monkeypox. For those preferring to make an appointment, they can go to myturn.ca.gov to find a nearby community or provider site that is vaccinating. With vaccine supplies improving, we are strongly encouraging all residents who are eligible for vaccination to walk up or schedule an appointment to get vaccinated. Next slide. Finally, in closing, we know that our residents, community partners, and healthcare providers may have questions about various topics related to monkeypox, including vaccines, cleaning and disinfection, testing, when to seek medical care, treatment options, and what to do if they've been exposed to the monkeypox virus. They can visit ph.lacounty.gov/monkeypox to stay up to date with the latest monkeypox information and access a variety of resources, including FAQs, flyers, signage, webinars, and guidance documents. Those who are interested in monkeypox data can also visit our online monkeypox data dashboards, which, as I mentioned earlier, are updated each Friday. As a reminder, another great way to stay up to date with monkeypox updates and resources is to sign up for our e-newsletter. And any resident who doesn't have access to the internet and needs information can call our public health call center at 1-833-540-0473. We have staff ready to take your calls in multiple languages 7 days a week from 8 a.m. to 8:30 p.m. Thank you. Happy to take some questions.
Thank you. Yeah, we're happy to take questions. Kim.
Thank you both. We will go ahead and move into the question portion. As a reminder, you can chat me, the host, or use the hand icon. Our first question comes from Jackie Fortier from KPCC. Jackie, you're unmuted. Please go ahead.
Hi there. Thank you for taking our questions. I have a couple questions from another reporter in our newsroom for Dr. Singhal, and then I have one for Dr. Ferrer. This other reporter says, I'm hearing reports that there are dorms in LA County jails that are quarantining due to monkeypox. Can you tell us which jails, how many dorms, and are there additional cases of incarcerated people with monkeypox other than the one identified on August 18th? So I guess the case that you said today, is that in addition to the one on August 18th or the same one? And then she also asked, I've heard that one LASD deputy working in the downtown criminal courts who is in contact with incarcerated people in the jails has tested positive for monkeypox. Can you confirm that? And then my question for Dr. Ferrer, how would you describe our COVID transmission rate? That would be helpful for our listeners. Low, medium, high, how would you describe it? Thank you.
I'll just start, and because my answer is much quicker than Dr. Singhal's. So we would describe it as an elevated, we have elevated transmission, significantly elevated transmission. We're doing much better than we were, but we're not where we'd like to be. So significantly elevated, people should continue to be cautious. There's, really simple steps we ask people to take. You can pretty much do everything you want. We obviously want people to be super careful about the extreme heat this weekend, but we expect people to have fun, to gather with others, and just to be mindful that with this much transmission, and we still have a highly transmissible variant that is capable of reinfecting people who have already been infected, it makes sense to be cautious still and to take some simple steps to just reduce the risk of either getting or giving COVID to anyone. So, but I'll turn it back over now to Dr. Singhal.
Sure. Thanks, Dr. Ferrer. Yes, so regarding what we know about what's happening in the jail. So as I mentioned in my remarks, we have one confirmed case in the jail system. We are always investigating. There may be, cases that come up where there's persons under investigation or others, and after we, complete an investigation, there may be more clear information and that the person was not actually in the jail system, or other information comes to light. So right now we are confirming one case in the jail system. As for what is happening in the system regarding quarantine of dorms and all of that, what I can say, we do not share details about that. What we can say is that we are following up with any close contacts. We are offering vaccination. The Corrections Health Services is actively vaccinating and following up on, on any other recommendations that the Public Health Department is providing. Regarding your second question, again, we would not share any details about any specific cases. Those are all, everything's still under investigation, and we never actually provide details on any single cases.
Thank you. We can take the next question.
Our next question comes from Ron Lynn from the LA Times. Ron, you're unmuted. Please go ahead.
Hi, doctors. Thanks so much for taking our questions. Really appreciate it. We have questions on death rates for the past summer, the timing on getting the Omicron booster, and a question on monkeypox. So first, there was some data shared by CDC today showing that the hospitalization rate for COVID in the older age group increased far more in the late spring and early summer relative to the increase in younger people. Given that there's a lot of talk about how Omicron is more mild, can you talk about why the death rate in recent months in LA County this summer worsened among older people, but got better among younger people compared to the same time last year? Is it that Delta came a little later last year than our summer Omicron wave, or is part of it how conventional vaccines became less effective against Omicron? The second question is when should people get their Omicron booster? Should they run out and get it as soon as possible, or should they wait until October, November to better time the peak effectiveness of the booster to the projected peak of the fall and winter wave? And then finally, on monkeypox, do you have any new insights on why cases seem to have continued to flatten, and when we might start to see a decline in new cases? Thank you.
Yeah, thanks so much, Ron. I'll start with the first two and then ask Dr. Singhal to help answer your last question. And so, the hospitalization data that CDC is sharing really, really matches the data that we just presented today that looked at mortality, which again, I think all along, we have noted that older people are at higher risk. I really like this question because it acknowledges that for some people in the community, as time has gone by, their risk for COVID actually hasn't been reduced, in spite of the fact that we have great tools that overall have led to dramatic declines in mortality rates, but particularly with the comparison between what was going on last summer and this summer, you can see very quickly that older people remain at high risk. I think the question about sort of why they were at higher risk probably has a complicated answer. In part, you noted that the time periods that we were comparing, we were experiencing much higher rates of transmission with the Omicron variant during our May to July time period this year than we were experiencing with the early days of the Delta variant transmission, May to July of last year. And you can see that clearly because there's actually less cases, that we have of people who died during those two time periods, less cases last year than there were people who died this year. But I think the answer is more complicated than it just may be related to the fact that we had many more people getting infected with Omicron during this sort of late spring, early summer this year than we did last year. I think you're right to note that there also is a relationship probably that's going to be hard for us to tease out without a more rigorous study that has to do with the sort of continued relationship between age and COVID. So I think when we look at the fact that people fully vaccinated have a big advantage to not getting severe illness and not passing away from COVID, we still see higher rates among fully vaccinated people at older ages who in fact can end up, both with severe illness and end up passing away. A lot of that, I think, is going to be related to both the underlying health status. We're going to have to pay attention now to recurring infections. Is this the first infection or the second infection or the third infection? And then when did they last get vaccinated/boosted? Because as you noted, there is some waning protection. While it remains a significant amount of protection against severe illness and death, there still is waning protection. Our hope is that with the new boosters, our priority will be to make sure that for older people with underlying health conditions, people with increased risk of lots of exposures, that we are getting them in and boosted. And I'll just segue very quickly to the second question of when to get boosted. In part, it depends on when you were last boosted or you last completed your initial series. In part, it depends on what activities you participate in that may increase or decrease your risk. And in part, it depends on what activities you may plan to participate in later on. We do hear from people who say, I want to maximize my protection for the fall, the late fall, and the winter, the holidays in particular, and I might wait. For people who are in relatively good health and younger, that may be an appropriate assessment. I think for people who are older, and it's now been a few months since they last got their booster, I think we're going to hear from CDC, later today or tomorrow, that the recommendation for them is going to be to come in once these boosters are available and go ahead and get that booster shot and do not delay. While there may be some waning of protection, you're going to gain a lot of protection by getting boosted, particularly if there's been some time that's passed since your last vaccine dose. Omicron is what's circulating right now, BA.4, BA.5. That's exactly what these boosters were made to protect us against. And, we just showed you that we still have a high rate of mortality associated with COVID. So I wouldn't delay for people who are at high risk. But I, like everyone else, needs to wait and see what that CDC guidance directs us to do, because I'm sure they're addressing this issue as well. And I'll turn it over to Dr. Singhal.
Thanks, Ron, for that question. So I'm not sure if my answer is going to be that different than last week, in that what are the reasons that that we think that this flattening is happening. I think first, there is evidence from from a study that CDC has done that there has been some behavior change that we've noticed. And so this, this is data that's available on their website. Was not done here in LA County, but generally had a sample from across the country, indicating that gay, bisexual, and other men who have sex with men did decrease their number of sexual partners, as well as one-time sexual encounters. So that change in sexual behavior may have contributed to this. In addition, we are hoping that the vaccination, getting the vaccine out, has also impacted transmission and hopefully decreased the number of cases from there. And then I think that one really important thing is really just going back to what we know about monkeypox virus and how it's transmitted, and just that the fact that it does not transmit that easily. You do need very close contact. You need close skin-to-skin contact, whether it be sexual or otherwise, to transmit. And so I think in that scenario, there is going to be a natural kind of burning out that you'll see after some time. We are not expecting that it's going to go away for forever. We likely will continue to see cases for a long time to come, but at least kind of the current high number that we're seeing, we are hoping to see that will go down. As to when we feel like the decline is going to happen, I will tell you the early data that I saw today still shows that we had close to 200 cases last week, and that number is going to continue to go up as more data comes in. So we're still at that same kind of sustained level, and so it's something that we'll have to continue to watch carefully. I think the number one message again is that we do want those that do fit our eligibility criteria, that feel like they may be at risk, should be coming in and getting vaccinated. We do think that is one of our key ways of really making sure that transmission continues to go down and that we do see a decline in the coming weeks.
Thanks. We can take the next question.
Our next question comes from Marla Tejas from Box 11. Marla, you're unmuted. Go ahead.
Hello, good afternoon. Thank you for taking our questions. My first question, Dr. Ferrer, is about what many parents refer to as backdoor masking of their kids. I'm referring to your 10-day close contact masking policy for students. On Tuesday, I know you updated the board and gave them your weekly briefing. At the same time, more than 500 parents submitted their names to the Board of Supervisors opposing the policy, saying essentially that the policy is a loophole that creates a mask mandate. They're asking you to align with state and CDC policies which recommend but don't require masking. So what is your message to these parents specifically, and are you considering aligning with state and federal policies as it relates to this 10-day close contact masking policy for students? Thank you.
Yeah, thanks so much, Marla. You know, that policy is not just for students. So just to be clear with everyone, that's the general policy for people who have had an exposure. It's not a separate policy for people at schools. It's the general policy for everyone. And I hear you about the concern. I mean, I have a hard time understanding sort of the opposition. And, you know, I point out that there's 1.3 million children in schools in LA County. So lots and lots of parents who obviously are pretty comfortable with this guidance around trying to prevent additional transmission. Now, I just think of it like personally, like if I knew I had been exposed to someone with BA.5, a highly infectious, easily transmissible virus, and that I would be infectious for 2 days before I developed any symptoms. I would not want to take any chances during what I know is a 10-day incubation period for the virus to unintentionally infect anyone else. So I'd be very relieved that I can go about my business, I can go to school, I can go to work, I can go to the grocery store. We ask that people be asymptomatic, so please don't have any symptoms after you've had that exposure, that you wear a mask while you're indoors and around others, and that you go ahead and get tested at some point between days 3 and 5. Now, that actually is exactly the same guidance and recommendations that both CDC and CDPH have asked everyone to follow. I think here we just tell people that this is what is universally asked for everyone to do after they've had an exposure. But A, it's not different in schools and it's different for all the rest of us. And B, it just seems sensible to us that we would do everything we can after we've had that exposure to not infect everyone else. I mean, I showed you the numbers at schools. So there are many, many cases at schools. There's hundreds of clusters at schools in order to make sure that, you know, children can stay safe, that teachers can stay safe, that we have the smallest number of people infected. This just seems like a wise step for us to continue to take. So I appreciate that you've heard from 500 parents. There are lots of other parents who I think understand why this is important and how it layers in sensible protections while we still have what for some people is a fairly dangerous virus circulating. So thanks for that. And we have time for one more question, Kim.
Yes, I have 2 questions from Emily Valdez. She's having trouble with her sound, so I'm going to go ahead and read them. Emily's from Next. Her first question is about the Omicron booster. She wants to know, when will it be available and what the priority groupings will be? And then the second part of that question is how many people we expect will want it.
Oh yeah, great questions. So this sort of Omicron booster, new booster, bivalent booster, we're anticipating, we've been told we should get doses between September 6th and September 9th. We've ordered, as I noted, 170,000 doses. We ordered everything that was made available to the county. I showed a map. We have lots of providers who will be getting those doses as soon as they come in and will be ready to open up. And we have, you know, almost 900 sites next week on Wednesday that should be, assuming we get these doses in time, should be able to go ahead and vaccinate. Right now, the FDA approval for those vaccines is for the Pfizer bivalent booster. It's for anybody who's 12 and older. For the Moderna bivalent booster, it's for anyone 18 and older. We'll have to wait and see if CDC encourages or asks for any additional prioritization, and then we would use that as we set up our vaccination clinics starting next week. So again, we're hopeful that the doses will be here shortly. Once CDC gives their final instructions, either later today or tomorrow, our wonderful network of providers here in LA County will be ready to go. I do want to note that the state system to make appointments for vaccinations will not be able to make appointments for boosters until later this month. So folks will need to use either existing systems that some of the pharmacies already use, or they'll need to come to sites and be prepared perhaps to wait a little bit. In terms of the numbers of people that are that may want to get vaccinated, we estimate that there's close to 7 million people that will be eligible. These are people that have either completed their initial series and or have been boosted. They're receiving their last dose at least 2 months ago. And we anticipate about half of those people will be very interested in coming in initially and getting vaccinated. Our hope, of course, is that by the time we get to later in the fall, everybody who's eligible is in fact fully boosted, because it will layer in a significant protection that will be helpful should we see another surge later on this fall.
Any closing remarks, Dr. Ferrer?
No, just thanks everyone. As always, we appreciate the coverage and your ability to communicate well with all of the viewers and listeners and your followers. So thanks so much, and we'll see you again next week.
Thank you to everyone who joined us today. As a reminder, additional media questions can be sent to our media inbox at media@ph.lacounty.gov. If you stick around, we will have Spanish remarks in just a few minutes. Spanish remarks will cover both COVID-19 and monkeypox. Thank you.
Testing, testing. Kim, can you hear me?
I didn't hear.
I didn't hear.
Did you click from your link?
Yes, I did.
Can you join in?
Hi, Tiana.
Oh,
Oh.
there you are. Hi.
Hi there. I can hear you.
Okay,
The
great.
video? No.
Yes,
can have
you
And the
can.
video works.
Okay, perfect.
Wonderful. Okay, I need to pull up your slides. So if you just give me like 2 minutes, you can keep your camera off if you like.
Sounds good. Thank you.
Thank you. Okay, Deanna, I've got your slides ready to go if you'd like to get started. Okay, good afternoon, everyone. Thank you so much for joining us for the Spanish portion of today's briefing. We have Deanna presenting. Deanna will present the COVID-19 slides, and then she will present the monkeypox slides. And I have them as two different decks, Deanna, so whenever you're ready.
Thank you so much, Kim. Buenas tardes y gracias por acompañarnos durante esta sesión informativa. Hoy daré una actualización, repasaré las medidas actuales de nuestras señales de alerta temprano y al final la información que acaba de presentar la doctora Rita Singhal, directora de Medicina de Salud Pública del Condado de Los Ángeles. En esta presentación compartiré puntos sobre nuestras métricas, nuestra designación de nivel comunitario de los CDC, las señales de alerta temprana del Condado de Los Ángeles, datos sobre grupos escolares y brotes, datos sobre las muertes por COVID, la vacuna de refuerzo Omicron que acaba de recibir autorización por la FDA y un repaso de medidas sensatas para mantenernos seguros durante el fin de semana feriado del Día del Trabajo. First slide, please. Esta semana pasada tuvimos una disminuciones adicionales significativas en el número de casos. Hoy estamos reportando 2,566 casos nuevos con un promedio de menos de 2,600 casos por día reportados durante la última semana. Esta es una disminución del 16% en comparación a los 31,100 casos que reportamos la semana pasada, debido a un cambio reciente en la encuesta utilizada por los hospitales para enviar datos al Departamento de Salud Pública de California, CDPH, por sus siglas en inglés. Ha habido algunas irregularidades en los datos de hospitalizaciones en los últimos días. Estamos trabajando en colaboración cercana con la CDPH para resolver este problema y hemos estado revisando los datos de hospital para reflejar los datos correctos a medida que estén disponibles. Los datos en las diapositivas son los datos más actualizados que tenemos a partir de esta mañana. Aunque todavía están sujetos a cambios, los datos preliminares muestran una disminución del 11% en el promedio de hospitalizaciones por COVID en el condado de Los Ángeles durante la última semana. La tasa promedio de positividad de prueba de 7 días también bajó esta semana y actualmente está alrededor del 8%, después de haber estado a un poco por encima del 9% la semana pasada. Reportamos un promedio de 14 muertes por día durante la semana, un pequeño aumento al promedio de 13 muertes por día reportados la semana anterior. En las últimas semanas hemos estado viendo ligeras fluctuaciones, lo que indica que las muertes se han frenado. Hablaré sobre las muertes por COVID en las diapositivas a continuación. Como discutiremos más adelante, los adultos siguen con un ritmo mucho más alto de muertes por COVID que los adultos jóvenes. Nuestros corazones están con todos aquellos que han perdido a un ser querido por COVID en las últimas semanas. Les deseamos paz y sanación. Next slide, please. En esta diapositiva veremos la trayectoria de la pandemia desde marzo de este año. La línea verde muestra el promedio de 7 días en el número de casos reportados diariamente. Se sigue demostrando la disminución significativa y continua en los casos reportados a mediados de julio. Estas admisiones hospitalarias diarias promedio de 7 días se muestran con una línea anaranjada. Sin embargo, como se indicó en la diapositiva anterior, los datos recientes son preliminares y están sujetos a cambios a medida de que recibamos información actualizada de CDPH. Según los datos preliminares, vimos ligeros aumentos en las admisiones hospitalarias en la semana pasada, pero parece que las admisiones están comenzando a disminuir nuevamente. Los problemas relacionados con los datos de hospitales recientes pueden haber contribuido a un ligero aumento. Como recordatorio, la línea de tendencia de casos se mide por el eje vertical en el lado izquierdo del gráfico, mientras que las líneas de tendencia de hospitalización y muerte usan el eje vertical en el lado derecho. Quiero señalar esto porque puede parecer que la línea de tendencia de hospitalizaciones ahora está por encima de la línea de tendencia de los casos, cuando de hecho las admisiones diarias en los casos son alrededor de 130 y los casos reportados son alrededor de 2.600. Como se señaló anteriormente y se muestra con la línea azul en esta diapositiva, el número promedio de muertes en 7 días reportados diariamente permanece relativamente estable. Next slide, please. Y bueno, seguimos utilizando el marco de niveles comunitarios de COVID-19 de los CDC para monitorear la atención dentro de nuestro sistema de atención médica causado por COVID-19. Ya sabrán, el marco de los CDC utiliza una métrica de tasa de casos y 2 métricas hospitalarias. La primera métrica en la tasa de casos de 7 días que los CDC reportaron ayer, con 193 casos semanales por cada 100,000 personas, una disminución de 229 reportados hace una semana. La primera de las 2 métricas hospitalarias en lo total de 7 días de nuevas admisiones hospitalarias por cada 100,000 personas. Hoy los CDC reportaron la tasa de Los Ángeles a 9.0 admisiones hospitalarias por cada 100,000 personas, una disminución leve comparada con el 9.6 que se reportó la semana pasada. Esperamos que a medida que los datos correctos estén disponibles en los últimos días, en los próximos días, veremos disminuciones en nuestra tasa de admisión. La segunda métrica que estamos viendo es el promedio de 7 días de la proporción de camas de hospitales ocupadas con pacientes con COVID. Ahora que nuestra tasa de casos semanales ha caído por debajo de 200 por semana por cada 100,000 personas, tomamos referencia a la parte superior de la tabla para determinar nuestro nivel de comunitario. Dado que las métricas hospitalarias permanecen debajo del número 10, anticipamos que los CDC podrán poner al condado de Los Ángeles al nivel comunitario bajo. Pasar al nivel comunitario bajo refleja que es un estrés mínimo en el sistema de atención hospitalaria en el condado de Los Ángeles asociado con COVID-19. Sin embargo, la transmisión viral con una tasa de casos de poco menos de 200 sigue siendo alta, ya que representa 2.600 casos nuevos por día. Esperamos que se siga reduciendo la transmisión a la tasa de casos semanales a menos de 100, lo que reduciría la cantidad diaria de casos nuevos a 1.400. Next slide, please. Aquí tengo una actualización sobre las señales de alerta temprana de COVID-19 para el condado de Los Ángeles. Desde que reportamos los datos la semana pasada, ha habido una disminución en 4 señales de alerta temprana en el porcentaje de visitas al departamento de emergencias relacionado con COVID, que bajó levemente de 6.6 a 6.4. La tasa de casos en áreas de ingresos más bajos cambió y bajó de 177 a 167 casos por cada 100,000 personas, y el número de brotes reportados en entornos para personas sin vivienda bajó de 13 a 4. El número de grupos de casos en sitios de trabajo reportados también bajó de 144 a 123. A partir de esta semana les daremos un seguimiento ya no le daremos seguimiento a la BA4.6 en la métrica de alerta temprana, dado a que esta métrica es para rastrear variantes emergentes. Ya no tiene sentido seguir rastreándolo. BA4 y BA5 han estado circulando en el condado de Los Ángeles durante casi 4 meses. A partir de la semana que terminó el 13 de agosto, BA4.6 representó el 1% de las muestras secuenciadas, lo que indica una preocupación baja. No hubo cambios en el sistema de aguas residuales, con un aumento reciente de 2 veces la concentración viral. Esto permanece en 0. Hubo 2 señales de alertas tempranas, ambas relacionadas con brotes y grupos de casos que experimentaron pequeños aumentos. El número de brotes en centros de enfermería especializada en los últimos 7 días aumentó de 16 a 21 y la cantidad de brotes nuevos en las aulas de las escuelas de kinder transicional al grado 12 aumentó de 13 a 19, lo que probablemente refleja el aumento en la cantidad de escuelas que reabrieron. Existen planes específicos que continúan promoviendo la seguridad en las escuelas y en los hogares para adultos mayores, y se sigue asignando a personal de salud pública para apoyar la mitigación de brotes en estos sitios. Repasaré algunas señales de alerta temprano con más detalle en las próximas diapositivas. Next slide, please. La variante Omicron sigue representando el 100% de las muestras secuenciadas. La subvariante BA5 de Omicron, como lo muestran las secciones rojas brillantes más grandes en la parte superior de cada barra, sigue siendo la subvariante predominante. En la semana que terminó el 13 de agosto, el 92% de todas las muestras secuenciadas fueron de BA5, un ligero aumento con respecto al 90% de la semana pasada. Los CDCs estiman en todo el país que a partir de la semana que terminó el 27 de agosto, la subvariante BA5 representó el 89% de las muestras. Los otros sublinajes clave que estamos rastreando han cambiado solo levemente, incluyendo la BA2.12.1, que se muestra aquí con barras anaranjadas y disminuyó levemente a 1.2%, y la BA4.6, que se muestra con barras amarillas, aumentó levemente al 1.3%. Hay reportes de que la BA4.6 está aumentando en otras partes del país, particularmente en el medio oeste, y los CDC estiman que la BA4.6 en nuestro país representa alrededor del 75% de los especímenes. No el 75, disculpen, representa alrededor del 7.5% de los especímenes. Sin embargo, según nuestros últimos datos locales, la BA4.6 sigue siendo muy baja aquí, sin aumentos grandes de una semana a otra. Hasta la fecha, solo se han detectado 4 muestras de la BA2.75, igual que la semana pasada, lo que indica que no hay un aumento significativo en la circulación de este sublinaje aquí en el condado de Los Ángeles. Dada la disminución de nuestra tasa de casos, nuestro nivel comunitario bajo y la ausencia de aumentos en la circulación de nuevas subvariantes, nos alenta que el riesgo está disminuyendo para muchas personas en el condado. Sin embargo, que la mortalidad por COVID sigue siendo alta para algunos residentes, y prácticamente todas las subvariantes que circulan actualmente están mostrando cierta capacidad de volver a reinfectar a aquellos que ya tuvieron COVID en el pasado, y sigue siendo que es muy prudente usar unas medidas de sentido común para evitar la exposición repetida a uno mismo y también para evitar transmitir el virus a otros. Next slide, please. En las últimas semanas, a medida que se han abierto más escuelas en el condado, comenzamos a ver aumentos en el grupo de casos y brotes. Esto no es inesperado, ya que las clases son en persona por primera vez después del verano. Este año, las escuelas no están requeridas a reportar todos los casos de COVID a salud pública. Sin embargo, sí deben reportar todos los casos de COVID que son en grupo de 3 o más casos en un salón de clases. en un club o en otro grupo que estuvieron en un sitio escolar dentro de 14 días antes de enfermarse. Esta tabla que se ve en la diapositiva muestra la cantidad de grupos de casos reportados en las últimas 3 semanas y la cantidad de casos de estudiantes y personal asociados en esos grupos. Han habido 624 grupos de casos reportados en las escuelas desde el 7 de agosto que involucran a más de 3.500 personas, de las cuales 3.555 fueron estudiantes. Puede ver aquí la cantidad de grupos reportados que se triplicó, creciendo cada semana durante el mes de agosto, probablemente por el aumento en la cantidad de escuelas abiertas. Next slide, please. También estamos investigando los brotes en las escuelas y en los programas para niños. En esta diapositiva muestran los brotes en los entornos escolares de kinder transicional al grado 12, estos programas para niños del verano hasta el comienzo del año escolar. Durante el mes de junio y julio, muchos de los brotes ocurrieron en campamentos y en programas juveniles, como verán en el color verde claro. Desde que los distritos escolares abrieron a principios de agosto, se han documentado 27 brotes en las escuelas primarias, como se muestra en el color violeta claro, y 8 brotes fueron asociados con programas de deportes juveniles, que se muestran con el color naranja, y 5 brotes en las escuelas secundarias. En agosto, solo hubo un brote asociado en una escuela secundaria. Debido a que Omicron sigue siendo excepcionalmente transmisible, muchos de los brotes involucran a un número alto de estudiantes. De los brotes abiertos, de los brotes más recientes, la mayoría involucraron a más de 5 estudiantes y un par de los casos involucraron a más de 20 estudiantes. Sería bueno realizar un seguimiento de la información sobre los brotes escolares. Se debe notar que la mayoría de las escuelas no han tenido ningún brote. Esto se debe a que las comunidades escolares siguen trabajando arduamente para mantener seguros a los estudiantes y a su personal. Todas las escuelas deben tener un plan de retención, respuesta y control de COVID-19 y un equipo de cumplimiento de COVID-19. Y aunque las escuelas no reportaron todos los casos a salud pública, aún están tomando medidas cada vez que haya solo un caso de COVID en una escuela. Cualquier estudiante o miembro del personal con COVID es enviado a casa para aislarse durante al menos 5 días después de que comiencen los síntomas. Si sale negativo al día 5, sus síntomas están mejorando y no tiene fiebre, puede regresar a la escuela el día 6 siempre y cuando use una mascarilla al regresar a la escuela. Y asegurarse de que use mascarilla al entrar a cualquier sitio hasta el día 10. Las escuelas también están haciendo todo lo posible para anotar los contactos cercanos y asegurarse que haya un plan durante este periodo de tiempo. Las escuelas hacen lo mejor que pueden para determinar los contactos cercanos y hay unos contactos cercanos que no se les pedirá ir a la escuela, quedarse en casa siempre que sean asintomáticos, que usen una mascarilla bien ajustada al estar dentro de cualquier aula con otras personas durante 10 días después de su última exposición y que se hagan la prueba una vez 3 a 5 días después de la exposición. Next slide, please. Ayer los CDCs hablaron sobre la disminución en la esperanza de vida para la gente que vive en los Estados Unidos por segundo año consecutivo. La esperanza de vida se redujo en el 2021 a poco más de 76 años, después de bajar a 79 años en el 2019, antes de la pandemia, y luego a 77 años en el año 2020. Esta es la primera vez que la esperanza de vida baja durante 2 años seguidos dentro de los últimos 100,000 años en los Estados Unidos. La esperanza de vida bajó más para los hombres que para las mujeres y aún más para las personas indígenas nativas de las Américas y nativos de Alaska que para cualquier otro grupo racial o étnico. El COVID-19 fue lo que impulsó este cambio. Como hemos dicho en otros reportes para la prensa, COVID-19 ha sido una de las causas principales de muerte aquí en el condado de Los Ángeles, acortándole la vida a demasiadas personas. Y aunque hemos visto descensos significativos desde el comienzo de la pandemia en la tasa de mortalidad asociada con COVID-19, el comienzo de la pandemia, gracias a las altas tasas de vacunas y de medicamentos terapéuticos, COVID, como podrá ver en esta diapositiva, sigue siendo un virus muy peligroso. Aquí se compartirá la tasa de mortalidad de COVID en el condado de Los Ángeles de mayo a julio de este año, a comparación con las cifras de mayo a julio del año pasado. Se indica que la tasa de mortalidad por COVID en el condado desde mayo de este año a comparación con las cifras del año pasado cambió. Se indica que esta tasa de mortalidad en general, así como la tasa de mortalidad para otros edades, adultos de 30 años y más, el número de muertes en grupos de edad para más jóvenes fue demasiado pequeño durante estos 2 periodos de tiempo para calcular tasas de mortalidad estables. En nuestro condado hubo más muertes y una tasa de mortalidad más alta este verano que el verano pasado, impulsada especialmente por tasas de mortalidad más altas en las personas mayores de 65 años, que siempre se han visto en mayor riesgo. Tristemente, la tasa de mortalidad de los residentes de 80 años o más se triplicó este verano en comparación con el verano pasado. Y la tasa de mortalidad de los residentes de edad de 65 a 79 años también aumentó. Si bien es importante tener en cuenta que las tasas de mortalidad de los grupos de edades más jóvenes bajó ligeramente durante este mismo periodo de tiempo, Omicron sigue siendo un variante capaz de causar mucho daño a tantos miembros de nuestra comunidad. Next slide, please. Si bien la última diapositiva mostró el impacto excesivo de las muertes asociadas con COVID-19 en los adultos mayores, esta diapositiva nos permite ver el impacto de COVID-19 en las muertes prematuras. La muerte prematura se define como una muerte que sucedió antes de los 75 años y las causas de muerte principales se determinan calculando los años de vida potencial que fueron perdidos antes de los 75 años. Es relevante prestar atención al impacto del COVID-19 en las muertes prematuras. En el 2020, el último año del que tenemos datos completos, COVID-19 fue la causa principal para la muerte prematura en el condado de Los Ángeles, que representó 79,000 años de vida potencial que fueron perdidos. Esto fue más la cantidad de años de vida perdidos por diabetes, suicidio, accidentes cerebrovasculares y cáncer del pulmón combinados. La sobredosis de drogas fue la segunda causa principal de muerte prematura en el 2020, con un aumento del 65% desde el 2019, y la enfermedad coronaria fue la tercera causa principal de muerte prematura. Es importante señalar que para todas las causas de muerte en esta diapositiva, excepto el suicidio, los años de vida potencial perdidos aumentaron del 2019 al 2020, lo que apunta al impacto más amplio de la pandemia de COVID-19, más allá de la morbilidad y mortalidad asociada con el virus en sí. En parte, esto se debe a que el virus altamente infeccioso se traduce en que muchas personas pasan por más obstáculos en el trabajo, en la escuela y en poder poner atención a su vida, a su cuidado médico y a su vida social. Es muy importante que estas dificultades es muy probable que estas dificultades tengan un impacto a nuestro bienestar colectivo y en general. Nos compartimos esta información, no estamos compartiendo esta información para crear alarma ni miedo, sino para explicar el por qué tiene sentido tomar precauciones sensatas, vacunarse, reforzarse y acceder a los medicamentos terapéuticos reduce la posibilidad de pasar por una enfermedad grave. El usar mascarillas, hacerse la prueba cuando es necesario y mantenerse alejado de los demás cuando esté enfermo reduce la transmisión. Estas acciones hacen que haya menos obstáculos mientras seguimos con las actividades diarias que dan sentido a nuestra vida, como visitar a familia y reunirse con amigos, ir al trabajo o ir a la escuela. Next slide, please. Debido a que las vacunas siguen siendo nuestra mejor defensa contra las enfermedades graves, nos complace reportar que los refuerzos de vacunas bivalentes ya están actualizados y finalmente recibieron la autorización de la FDA este martes. Esperamos una vez que los CDC completen su revisión, estos refuerzos podrían estar disponibles para el condado de Los Ángeles la próxima semana. La FDA modificó las autorizaciones de uso de emergencia para las vacunas Pfizer y Moderna para incluir estos refuerzos bivalentes. Estas vacunas de refuerzos, que también se conocen como refuerzos actualizados o refuerzos bivalentes, contienen dos componentes de ARN mensajero ARNM del virus SARS-CoV-2, una de las cepas originales del SARS-CoV-2 y la otra es de los lineajes BA4 y BA5 de la variante Omicron del SARS-CoV-2. El refuerzo actualizado de Moderna está actualizado para un uso de personas mayores de 18 años y el refuerzo actualizado de Pfizer está autorizado para el uso de personas mayores de 12 años. Ambos recibieron autorización para su uso como dosis única de refuerzo administrada al menos 2 meses después de la vacuna inicial o de un refuerzo. Tenga en cuenta que con esta nueva autorización, la FDA suspendió las vacunas de ARNM monovalentes originales de Pfizer y Moderna para su uso como refuerzos en personas mayores de 12 años, aunque la fórmula de la vacuna de Pfizer para niños todavía está autorizada como un refuerzo para niños de 5 a 11 años. Esto significa que en los sitios de vacunación en el condado de Los Ángeles podrían administrarse refuerzos a los residentes mayores de 12 años hasta que recibamos los nuevos refuerzos binavalentes de la dosis única. El Comité sobre el Uso de Vacunas de los CDC se reunirá hoy, el 1 de septiembre del 2022, para analizar los refuerzos bivalentes y se espera que compartan una orientación sobre su uso muy pronto. Next slide, please. En el condado de Los Ángeles estamos listos para comenzar a administrar la dosis de la primera semana el miércoles 7 de septiembre. Ya hemos recibido 170,000 dosis y esperamos recibir estas dosis entre el 6 y el 9 de septiembre. Más de 300 proveedores de atención médica en el condado de Los Ángeles están preparados para poder administrar un refuerzo contra la variante Omicron a partir de mediados de septiembre y se espera que muchos proveedores ofrezcan los refuerzos en varios sitios. Este mapa muestra Todos los sitios que darán la vacuna de refuerzo la próxima semana. Esto incluye a 12 sitios de salud pública, 701 clínicas móviles de la vacuna, 245 sitios comunitarios, farmacias y clínicas, un total de 958 sitios en el condado de Los Ángeles. Nuestra prioridad es crear un acceso fácil al refuerzo para todos los que sean elegibles. Y a medida que implementamos la vacuna de refuerzo bivalente, nos mantenemos enfocados en garantizar que haya buen acceso a los refuerzos en las comunidades más afectadas que se muestran en este mapa en las áreas con el color verde claro. Como siempre, los residentes y trabajadores pueden buscar sitios que ofrezcan el nuevo refuerzo en nuestro sitio web, vacunatelosangeles.com. Puede hacer clic en buscar una ubicación y luego buscar por el tipo de vacuna que necesita. Next slide, please. Y ya que todos esperamos celebrar el Día del Trabajo, expresamos nuestro profundo agradecimiento a tantas personas que trabajan arduamente en todo nuestro condado, enfrentándonos a dos desafíos este fin de semana: la circulación continua de COVID-19 y además el calor muy alto en la mayoría de nuestro condado de Los Ángeles. Al divertirnos con nuestros familiares y amigos, hay unos pasos prácticos a seguir que pueden hacer que nuestras celebraciones sean más seguras y más cómodas. De costumbre, pedimos que aquellos que estén enfermos o salgan positivos por COVID se queden en casa. Si está infectado, puede beneficiarse de comenzar a tomar medicamentos terapéuticos al inicio para prevenir una enfermedad grave. Por favor, consulte con su doctor de atención médica de inmediato o llame a nuestra línea de información de salud pública sobre el acceso de tratamientos gratuitos para evitar una enfermedad grave. Nuestra línea de información está en el número 833-540-0473 y está abierta todos los días de la semana de las 8 de la mañana a las 8:30 de la noche. También puede visitar en nuestro sitio web en ph.lacounty.gov/COVID Care, que aparece en la pantalla, para obtener una orientación adicional sobre qué puede hacer si está enfermo y cómo puede manejar sus síntomas. Hágase la prueba si siente unos síntomas de COVID o si fue expuesto a alguien con COVID. Hacerse la prueba antes y después de viajar es una medida de protección recomendada que puede ayudar a reducir la propagación, al igual que pruebas antes de reunirse con otras personas dentro de cualquier lugar, especialmente si pueden estar presentes adultos mayores o personas con problemas de salud subyacentes. Reunirse al aire libre reduce el riesgo de transmitir COVID-19 drásticamente. Dado el calor excesivo, tome precauciones adicionales este fin de semana para evitar la exposición al sol y el estrés por el calor. Si está al aire libre, reúnase en la sombra, debajo de árboles, sombrillas o en patios con techo. Tenga suficiente hielo y agua para todos y use ventiladores para refrescarse. En este calor extremo, tiene mucho sentido para muchos trasladar sus reuniones en espacios cerrados. Puede incrementar la ventilación abriendo puertas y ventanas, usando filtros de aire y configurando sistemas de HVAC para poder mantener el aire fresco. También se puede recomendar el uso de mascarillas si se reúnen en espacios cerrados con personas cuyo estado de COVID-19 se desconoce. Dado el alto calor que estamos pasando, les pedimos a todos que hagan su parte en cuidar a los más vulnerables. Comuníquese con sus amigos, familiares y vecinos. Los adultos mayores, los bebés y las personas con problemas de salud subyacentes son mucho más vulnerables al estrés por el calor. Por favor, nunca dejen a los niños, a mascotas o personas mayores en carros estacionados, ni siquiera por unos minutos. Beba mucha agua y busque atención médica para usted o para cualquier persona que muestre síntomas de enfermedades relacionadas con el calor. Tendremos abiertos varios centros de refrescamiento con aire acondicionado en todo el condado y muchos ya están disponibles. El pasar unas horas en un ambiente fresco puede salvar vidas cuando las temperaturas son tan altas. Puede obtener más información sobre los centros de refrescamiento y más consejos para mantenerse fresco en nuestro sitio web, abreviado aquí en la pantalla en tinyurl.com/Extreme Heat 2022. Y ahora, en un minuto, voy a dar el reporte de la viruela del mono. Gracias. Next slide deck, please, Kim.
Whenever you're ready.
Thank you. Me da mucho gusto poder brindarles una actualización sobre la viruela del mono que acaba de presentar la doctora Rita Singhal. Les daré un reporte sobre la situación actual, los datos sobre la viruela del mono en personas que viven con el VIH y acerca de las personas que ya han recibido la vacuna. Hablaré sobre la elegibilidad y distribución de las vacunas y los recursos disponibles para los residentes y socios. Internacionalmente hemos superado los 500,000 casos con más de 51,257 casos de viruela de mono reportados en 99 países. Esto incluye casi 19,000 casos confirmados en los Estados Unidos. Ahora, California es el estado con la cifra más alta en nuestro país, con 3,629 casos. Hasta el día de hoy se han identificado 1,518 casos de viruela de mono en el condado de Los Ángeles, 82 casos en Pasadena y 82 casos en Long Beach y 18 casos en Pasadena. El perfil de casos en el condado de Los Ángeles sigue alineado con lo que se ve en el país y a nivel mundial. Como se reportó en nuestro panel de datos el 26 de agosto, la edad promedio de casos de viruela de mono dentro de nuestro condado sigue en 35 años de edad. El 98% de los casos de viruela de mono se reportaron entre hombres y el 96% de los casos donde se conoce la orientación sexual reportaron ser de la comunidad LGBTQ y más. Nuestro tablero ahora incluye datos sobre la viruela de mono entre las personas sin vivienda, PEH por sus siglas en inglés. Hay 48 casos de viruela de mono en las personas sin hogar. 22 de estos casos se encuentran entre personas que están en situaciones de vivienda temporal, hospedándose en hoteles o moteles o durmiendo en un sofá. 16 casos están desplazados, o sea, viviendo en la calle, en un campamento o en un parque. Y 5% de los casos se encuentran en entornos de vivienda colectiva de personas sin hogar, como un refugio. Se reportó un caso en el sistema de cárceles. En el condado de Los Ángeles han habido 49 hospitalizaciones entre personas con viruela de mono. No han habido muertes debido a la viruela del mono en el condado de Los Ángeles o en California. A principios de esta semana se reportó una muerte de una persona inmunocomprometida con viruela de mono en el estado de Texas. Los CDC aún no han confirmado ni reportado extensamente. Esta sería una de las pocas muertes entre los casos de viruela de mono observados internacionalmente en países donde la viruela de mono no es endémica. Next slide, please. Aquí tenemos la curva epidemiológica o EPI para corto de los casos de viruela de mono en el condado de Los Ángeles por fecha de episodio, o sea, cuando el caso fue reportado al inicio de los síntomas. Las columnas muestran el número de casos semanales, donde a mediados de mayo hasta la semana pasada. Como podrán ver aquí, después de un aumento constante durante junio y julio, alcanzamos un máximo de 233 casos nuevos en la semana que terminó el 6 de agosto. Desde entonces, la cifra se ha mantenido fija con un pequeño descenso y luego un aumento leve en los casos de la semana que termina el 20 de agosto. Debido a un retraso en el reporte de casos, los datos de la semana pasada están incompletos. Además, puedo reportar que a pesar de que el mes pasado vimos una duplicación de casos de viruela de mono, en tan solo 8 días, nuestro tiempo de duplicación de casos ahora es de 22 días. La curva EPI de estabilización y el tiempo de duplicación más largo pueden ser indicaciones tempranas de que la transmisión del virus de la viruela de mono está comenzando a bajar en el condado de Los Ángeles. Se observaron tendencias similares en los países a donde comenzó el brote, así como en otros municipios de los Estados Unidos. Estaremos observando esta curva durante el resto de esta semana y la próxima para ver si se mantiene estable. Next slide, please. Hoy también estamos reportando sobre unos datos nuevos acerca de la coinfección por el VIH y la viruela del mono. Estos datos que se obtuvieron comparando los casos de viruela de mono con los datos del VIH indican que el 42% de los casos de viruela del mono en el condado de Los Ángeles han sido entre personas que viven con VIH, lo que es consistente con lo que está estimando el CDC por alrededor del país. El 89% de las personas con VIH y diagnosticadas con viruela del mono en el condado de Los Ángeles recibieron atención médica para el VIH en los últimos 12 meses y el 77% tenían supresión viral. Para entender el impacto de la infección por el virus de la viruela del mono en este grupo, Salud Pública está colaborando con los CDC en un reporte nacional que relatará las manifestaciones clínicas de la viruela del mono entre las personas que viven con VIH, utilizando datos de jurisdicciones locales de salud en 5 estados en nuestro país. Estos datos resaltan la necesidad de nuestros proveedores que se aseguren de los pacientes con VIH que son elegibles para la vacuna contra la viruela de mono que estén vacunados. Estamos trabajando para incorporar a los proveedores de VIH restantes que no están en nuestra red de proveedores de vacunas contra la viruela del mono, y también estamos reuniéndonos con grupos comunitarios y proveedores para analizar los mensajes y el alcance a esta población. Next slide, please. Con el aumento de los suministros de vacunas, Salud Pública sigue distribuyendo y administrando la dosis de la vacuna contra la viruela del mono rápidamente y a medida que están disponibles. De la fase 1 hasta la primera parte de la fase 4 de las asignaciones federales, hemos recibido 113,000 dosis de vacuna Jynneos. Hasta la fecha de ayer se han administrado el 50% de estas dosis, o sea, 56,271 dosis. Les recordamos la semana pasada que el gobierno federal anunció las distribuciones de la fase 4. Al condado de Los Ángeles se le han dado 24,767 viales o alrededor de 120,000 dosis. Voy a repetir ese número otra vez. Al condado de Los Ángeles se le ha dado 24,767 viales o alrededor de 120,000 dosis. Al final de la semana pasada, el condado de Los Ángeles recibió su primer tramo de 800,260 viales o aproximadamente 41,300 dosis. Las dosis restantes a las que el condado de Los Ángeles tendrá acceso una vez que hayamos administrado el 85% de las dosis actuales de la vacuna, suma alrededor de 82,500 dosis para los tramos 2 y 3 de la fase 4. Recuerden que estos números son de dosis y que se basan en extracción y administración de 5 dosis por vial. Next slide, please. Hoy también tenemos datos demográficos clave acerca de las personas que ya se han vacunado contra la viruela del mono en el condado de Los Ángeles. Esto es basado en datos del 30 de agosto para 47,404 primeras dosis de vacuna que fueron administradas. Adicionalmente, hasta el martes se han administrado 6,716 de la segunda dosis, con la excepción de nuestros datos de raza y etnicidad que discutiré a continuación. Los datos demográficos de quienes recibieron una primera dosis son consistentes con el perfil demográfico de nuestros casos de viruela del mono. La edad media fue de 37 años. De nuevo, la edad media fue de 37 años. El 91% reportaron ser hombres y el 91% se reportaron de orientación LGBTQ o más. Los datos por región indican que el 42% viven en la área de planificación de servicios conocida como SPA, el SPA 4, y el 14% viven en el SPA 2. Estos datos demográficos ya están disponibles en nuestro tablero público que se actualiza semanalmente los viernes. Next slide, please. Al observar nuestros datos de raza y etnicidad, hubo algunas diferencias notables en nuestros casos de viruela del mono en las personas que han sido vacunadas contra la viruela del mono. Aquí verán el desglose por raza y etnicidad de nuestros casos de viruela del mono. A la derecha, la raza y etnicidad de quienes recibieron la primera dosis de la vacuna contra la viruela del mono. Mientras el 40% y el 11% de los casos de viruela de mono se encuentran entre la población latinex y negra respectivamente, solo el 32% de la gente latinex y el 9% de la comunidad negra o afroamericana recibió la vacuna. Para abordar estas tasas más bajas de vacuna entre la población latinex y negra, la salud pública está trabajando con organizaciones comunitarias que atienden a esas poblaciones en esfuerzos de controlar la viruela del mono, que incluyen, entre otros, realizar actividades de divulgación para garantizar una mayor conciencia y educación e identificar lugares para eventos de vacunación que mejoren el acceso a la vacuna. Next slide, please. Como se compartió la semana pasada, luego del anuncio de las asignaciones de la vacuna de la fase 4 en el condado de Los Ángeles, Salud Pública amplió sus criterios de elegibilidad para las vacunas para incluir a grupos adicionales que tienen un mayor riesgo de infección por la viruela del mono. Esta semana les recordamos a los residentes a que cumplan con nuestros criterios de elegibilidad amplios, que se vacunen lo antes posible para protegerse y ayudarnos a seguir reduciendo la transmisión del virus en nuestro condado. Hombres gay bisexuales, personas transgénero que hayan tenido múltiples parejas o anónimas en los últimos 14 días, así como aquellos que han tenido contacto de piel a piel o contacto íntimo, como besos y abrazos con personas en lugares o eventos grandes en los últimos 14 días, son elegibles para la vacuna. Además, las personas de cualquier orientación sexual o género que hayan tenido sexo comercial o transaccional en los últimos 14 días, es decir, sexo a cambio de dinero, vivienda, comida u otros bienes o para otros gastos, también son elegibles para la vacuna contra la viruela del mono. Los residentes que cumplen con los criterios de elegibilidad anteriores siguen siendo elegibles para la vacuna y les seguiremos dando prioridad a los residentes inmunocomprometidos, que incluye a aquellos con VIH avanzado o no controlado, ya que pueden tener un alto riesgo de enfermedad grave. Los residentes que no tengan acceso a Internet y necesiten ayuda para poder hacer una cita o acceder a la vacuna pueden llamar al centro de llamadas de salud pública al número 833-540-0473. Nuestro personal está disponible para recibir llamadas los 7 días de la semana, de las 8 de la mañana a las 8:30 de la noche en varios idiomas. Next slide, please. Los residentes del condado de Los Ángeles que sean elegibles para la primera o segunda dosis de la vacuna contra la viruela del mono pueden aprovechar de varias opciones para vacunarse. Ahora tenemos 53 proveedores comunitarios que vacunan activamente a sus pacientes contra la viruela del mono. Recomendamos a los residentes que son elegibles para la primera dosis o que les toca ya recibir su segunda dosis, que se comuniquen con su proveedor de atención de costumbre y pregunten si ofrecen vacunas contra la viruela del mono. Los residentes también pueden vacunarse a través de los pods de salud pública y otros sitios comunitarios. El proceso ya se ha simplificado y no es necesario registrarse previamente. Para algunos sitios, los residentes elegibles pueden ir directamente y para otros, si hay citas disponibles. La lista de sitios de vacunación abiertos se puede encontrar en nuestra página web de salud pública en ph.lacounty.gov/monkeypox. Para aquellos que prefieran hacer una cita, pueden ir a myturn.ca.gov para encontrar un sitio comunitario cercano o un sitio de proveedores. Con la mejora de los suministros de vacunas, recomendamos fuertemente a los residentes que son elegibles para la vacunación a que se presenten o programen una cita para vacunarse. Next slide, please. Y bueno, ya para cerrar, sabemos que nuestros residentes, socios comunitarios y proveedores de atención médica pueden tener preguntas sobre varios temas relacionados con la viruela del mono, acerca de las vacunas, de la limpieza y desinfección, sobre las pruebas y cuándo se debe buscar atención médica, opciones de tratamiento y qué hacer si es posible que se haya estado expuesto al virus de la viruela del mono. Puede visitar nuestra página ph.lacounty.gov/monkeypox para mantenerse al día con información más reciente sobre la viruela del mono y acceder a una variedad de recursos que incluye preguntas frecuentes, folletos, materiales, seminarios web y orientación. Aquellos que estén interesados en los datos de viruela del mono también pueden visitar nuestros tableros en nuestra página que se están actualizando cada viernes. Como recordatorio, otra manera de mantenerse al día con nuestras actualizaciones es al suscribirse a nuestro boletín informativo electrónico, y si no tiene acceso a Internet o necesita información, puede llamar a nuestro centro de llamadas que se muestra en la pantalla al número 833 540-0473. Tenemos personal listo para atender su llamada los 7 días de la semana, de 8 de la mañana a 8:30 de la noche, en varios idiomas. Y esto concluye nuestra presentación del día de hoy. Muchas gracias por su tiempo y nos vemos para la semana que viene. Gracias.
Thank you so much to everyone who joined us today. As a reminder, additional media questions can be sent to our media inbox at media@ph.lacounty.gov. We appreciate you joining us, and we'll see you next week.